I'm Kirstine Thompson from Glasgow City Council, in case you don't know me. I'm the lead for the Glasgow's holiday programme within the council. And we've brought this session to you today in conjunction with Glasgow's Food Policy Partnership. And it's also supported by the Glasgow Centre for Population Health Communications team. So I think we've mentioned if you could keep your sound camera off while speakers are presenting, you'll be asked to unmute and turn your camera on for the questions in the breakout rooms later, so that this will allow you to see the presentation slides better if you go to the speaker view on the top hand right of your screen, top hand right corner of your screen. So it's good to see you all today. Some of you have been delivering holiday programmes for some time now, and we've also got some new organisations with us today as well. So a wee bit about a background to the holiday programme. The council started funding this programme back in 2018, and we've made a commitment to review the programme each year to see how we can make improvements, both for yourselves as providers and for the council too. So we've had a few online sessions, and some of the feedback that we got from the last one was that you welcomed the opportunity to come together to share experiences and see how you could work better together. And at the last one, there was some discussion around the food that was being provided. So when we were contacted by the Food Policy Partnership, we thought this would be an excellent opportunity to bring everyone together to hear more about healthy food options. So we appreciate it can be challenging to provide healthy and nutritious food, both for cost reasons, and also children don't want to also eat the healthy option. So hopefully today you'll get some new tips and ideas for providing healthy and nutritious food during your programmes this year. So during the session, there'll be some presentations about healthy food offering and community food. So I'm going to hand over now to Jill Murray she's the Public Health Programme Manager in the Glasgow Centre for Population Health, and she's going to talk about how healthy is Glasgow and its children.
Thanks, Kirstine. Thanks so much to you all for joining us today. I really hope you find this session interesting and useful. And obviously, a number of you have been delivering the holiday programme for some time, and we're really looking forward to hearing from you later this afternoon and the opportunity to maybe share some tips and ideas between different participants today. Firstly, I'm going to spend a few minutes giving you some background, which I hope will help you understand why we're keen to work with you to help children and young people eat a tasty and nutritious diet. As Kirstine said, I'm Jill Murray. I work at the Glasgow Centre for Population Health, and I am also here representing the Glasgow Food Policy Partnership, which is a multi-sector partnership that is established to work together across different sectors to try and build a more sustainable and healthy food system in Glasgow. So moving on to the first slide, what I wanted to start off with is just a quick outline of why child nutrition is important, and I'm sure you will know this already, but child nutrition is vitally important for their lifelong health, and the impact of childhood nutrition lasts right throughout life. Nutritious food is important in the early years and throughout childhood and young adulthood because it promotes growth and development. Healthy eating in childhood supports physical growth and development, prevents harmful health conditions, and it also boosts brain development at a really crucial time in young people's lives. It helps strengthen immunity. We know that proper nutrition, if you can back one, we know that proper nutrition can enhance immunity, helping children to stay healthy. And good nutrition in the early years helps encourage healthier habits. So it fosters lifelong healthy eating habits and provides essential vitamins and minerals. So overall, well-being is improved by nutritious food, well-being in terms of emotional, psychological health, and good food also influences children's moods and behaviour, which is vitally important when they're interacting with each other and at activities. And we know that there's very strong evidence that good nutrition in childhood is important and protects against many cancers, type 2 diabetes and cardiovascular disease. However, we know that in Glasgow, as in other parts of the country, we have a particular issue with food insecurity and growing food insecurity. I know you all know this is a big problem, and you'll see it within the communities in which you work. And it's one of the main reasons for the holiday programme. Food insecurity was not a particularly widespread issue 10 years ago, although we were still concerned at the number of people forced to rely on food banks. But food insecurity has sadly been increasing since then. And looking at Scotland as a whole, the 2023 Scottish Health Survey found a significant increase in the levels of food insecurity, with 14% of all adults reporting experiencing food insecurity over the previous year, which had increased from 9% since 2021 and was the highest level in the time series since 2017. In terms of children in Glasgow, in terms of Glasgow's Scotland's poorest city, Glasgow, the most recent data is more concerning than Scotland as a whole. And you'll see on the screen here that the Health and Social Care Partnership's Health and Wellbeing Survey found that 21% of adults had experienced food insecurity at least once in the previous year, which was an 11% increase since 2017-18. And although this is an average between areas, we found an even, a significantly large difference between areas, and specifically between the most and the least deprived areas, with people living in the most deprived areas more likely to have experience of food insecurity in the previous year. In terms of Glasgow's children, we don't have figures for childhood food poverty, but we do know about childhood poverty. And we know that a quarter of all children in Glasgow live in poverty, and that's over 24,000 children. And this hasn't changed much in the last 5 years, but the level of poverty that they are experiencing, we know has increased. We also know that children and families with disabled people, with minority ethnic families and lone parent families are particularly likely to grow up experiencing poverty. In terms of food, what we know from the NHS Schools Health and Wellbeing Survey is that 27% of children sometimes go to school or bed hungry. Clearly, this is deeply concerning. So on to the next slide then. Not having enough to eat is clearly a real issue, but not having enough nutritious food to eat adds on top of that. So if young people and children are finding it hard to get enough food to eat, it's really important that when they do eat, that food is nutritious. But what we're finding is that the dietary health of Scottish children is stubbornly poor. For a number of years, we've been trying to improve the situation, yet we've found that too many children in Scotland struggle to get an adequate or balanced nutritional diet. Of particular concern is their low intake of fruit and vegetables and fibre, such as wholemeal bread or whole grain cereals, and their very high levels of sugar consumption. The data that we have suggests that there's not been very many changes in the consumption of fruit and veg in recent years, with only a fifth of children eating the recommended 5 portions of fruit and veg a day, and 1 in 10 children not eating any fruit and veg in the previous day. On average, most children and young people eat 3 portions or less of fruit and veg a day, but that's an average, and that's across the whole population. And we know that there are big differences in the food consumed in poorer areas compared to better off areas. We know that those living in situations where they're experiencing poverty will be less likely to eat nutritious food. And we know that young people approaching their early teens will be less likely to eat healthy food too. And we know this because healthier foods are on average more expensive than unhealthy options. We know the cost of healthy food has increased very rapidly in recent years. And we know that healthier foods tend to be less available in many areas, and particularly in areas of higher deprivation. We also know that fast food high in fat, salt and sugar are much more available. They're marketed heavily to young people, and they're often sold cheaply. So there's lots of reasons why we're concerned about children's nutrition, and we want to do everything we can to help improve it. Go to the next slide, please. So the reasons why we're so concerned about these differences in food consumed by children and young people is because the differences in access and consumption of nutritious food contributes to the health inequalities as children, young adults, and throughout their life. The latest government data on childhood weight highlights persistent inequalities in obesity right from the first year of school. In Scotland, children from the most deprived communities are nearly twice as likely to be living with obesity at school entry than those in the least deprived areas, and this is very likely to persist into adulthood and result in long-term health issues. In relation to sugar consumption, children in the most deprived communities suffer from twice the rate of tooth decay compared to their less deprived peers. Again, this contributes to lifelong health issues, pain, and treatment, high cost of treatment. We also know that Glasgow has a poor reputation for health, largely because of the life expectancy issues in Glasgow, particularly in Glasgow, across Scotland, but in Glasgow and particularly in our most deprived areas, we have some of the lowest levels of life expectancy and healthy life expectancy. We want to change this, and part of that is enabling everyone to eat good, nutritious food. So, how do we make a difference then? There are national and local strategies that lay out how Scottish Government and Glasgow City Council and NHS Greater Glasgow and Clyde are all trying to address this, specifically trying to improve equity, health and sustainability across our food system and enabling everybody to eat good, nourishing food. Nationally, we have the Good Food Nation Scotland Act, and we're expecting the Good Food Nation plan later this year. And that is in the process of being implemented, and it will focus on bringing policies together at national level to support a move towards a fairer, healthier and more sustainable food system. In Glasgow, we have the Glasgow City Food Plan that seeks to bring a wide range of different policies and strategies together in one action-oriented plan, which different organisations are working together to deliver. An example of what is happening at local level is the school meal programme, giving all children in primary school the opportunity to eat a nourishing meal every day. Similarly, it's the recognition of the scale of food security and the importance of childhood nutrition that saw the introduction of the holiday programme, and the reason we're here today to talk about it. We know that changing what people eat requires a lot of different actions from different organisations. It's not just about telling people what they should eat and expecting them to do it. It's about making tasty, nutritious food more accessible and more affordable and more available, and encouraging people to try new things they might not have had the opportunity to try before. So hopefully today we'll offer perhaps some hints and tips and maybe some encouragement to use the opportunities the holiday programme provides to try and do that for the children and people that you're working with. Thanks very much. I'm going to pass now to Rika, who's going to give you a quick overview of the current healthy eating guidelines.
So thank you very much for that introduction. What I will be talking about now is a little bit about the latest guidelines. Some of this you probably know already. Most of you probably know about the Eat Well guide, which shows the proportion of the types of food that you need to have a healthy, balanced diet. So I will go some of the recommendations of this. The guide that I'm actually using here today is the Scottish Eat Well guide, which was developed by our partners, Nutrition Scotland, who we will hear from during this session as well. And you don't actually have to get the balance right for every single meal, but it helps you to get the proportion right over a period of time, over a period of a week or a day, for example. So I'll go through some of the recommendations. You've already heard Jill mention the 5-a-day message, which most people are familiar with. But as we heard before, children and young people, on average, they only eat about 3 portions, which is really quite concerning. Also, a lot of these portions come from fruit rather than vegetables, and variety is the key when eating a healthy diet. A portion size for an adult for fruit and vegetables is 80 grams. However, this varies for children depending on their age and size, and of course, activity levels as well. As a rough guide, 1 portion of fruit and vegetables is what you can fit in the palm of your hand. It can be an average size apple, for example, or a heaped tablespoon of dried fruit. And And more variety of fruit and vegetables that you eat is the better. So what I like to think is eating the rainbow is sort of the gold standard. It encourages people to try different colors, and it's also quite fun for children as well. So the holiday program actually provides an excellent opportunity to try different fruit and vegetables that people, their families might not be able to afford to try. And it could also make the lunch sessions quite fun as well. And don't be put off by some children rejecting some of the new foods, because we know that children actually need to try new foods several times before they develop taste for them. Eating seasonal food is often also cheaper. Thinking about strawberries over the summer, for example. They're tastier and better for the environment. So if you have access to a local growing space for produce, you might want to offer this at your holiday club. And some of you, I know, do this already. This will make sure that some of the food that you offer is also more sustainable by reducing the carbon footprint. Carbohydrates are a food group that's very important source of energy, especially during the lots of the holiday activities that your clubs will offer. Whole grain varieties are a good source of fiber, which most Scottish people don't get enough of. In fact, only 6% of the population get the recommended intake of 30 grams a day. And why is fiber so important? It's important for your gut health, your digestive system, heart health, but it also keeps you fuller for longer, which might be also quite useful for running the holiday club. So you might want to consider offering children a mixture of whole grain varieties and maybe half and half options, such as bread, pasta, rice, even potatoes with skin. So protein is very important for growing children. It also repairs muscles after all those holiday activities and exercise. So when you're planning meals, try to maybe buy some leaner cuts of meat and avoid processed meats such as bacon or ham, because they are not only really highly processed, but they tend to be really high in salt as well. Current advice is also to include more plant-based proteins such as beans, peas, and lentils. These are very fiber-rich. They're environmentally friendly, often also cheaper and suitable for vegetarians and vegans, which might help you when you're catering for different diets and people from different cultures. They can also help you bulk up meals and make meat-based dishes a little bit healthier. However, it is important to note that some children might be allergic to some pulses, lentils, for example. They also have a benefit of, if you're using dried or tinned pulses, for being good for reducing food waste, as they have a very long shelf life. I've included a picture here of our Full of Beans campaign, which we ran last year. And all these campaign materials, including some recipes, are still available from our website. In regards to dairy products and alternatives, it's really important to include some calcium-rich food in children's diets, as they're very good for developing bones and also for your teeth as well. I know Jill mentioned how some children don't have very good oral health in Scotland. Low-fat milk and dairy are very good sources and recommended for children over 2 years of age. If you offer plant-based milks and other dairy products, it will be quite important to check that they have been fortified with calcium and other vitamins. Also good to look at the label to choose options that are low in sugar, as many flavored milks and yogurt can be very high in sugar indeed. So that brings me to high fat, salt and sugar foods and UPFs, otherwise known as ultra processed foods, which have received a lot of attention in the news recently for their detrimental effects on health. The main reason for this is that they are really generally quite high in fat, sugar and salt, which can be addictive and also in large amounts quite detrimental to our health. We understand that as holiday club holders, you might not be able to avoid these foods completely, which is completely fine. But if you're buying ready-made foods as sandwiches in, the best thing to do is check labels and the traffic light system in the front of the package. You can see an example of the traffic light system on a label on this slide. So generally, if you have more greens in the front of the package, it's a good choice. It tends to be lower in fat, salt, or sugar, depending on what category it falls under. Amber or the yellow has moderate amounts, and high, the ones in red includes high amounts of these nutrients, and they should only be enjoyed occasionally. In regards to hydration, it is very important to have lots of drinks on offer for children, so that they're well hydrated, especially in the summer, doing lots of outdoor activities. But do keep in mind that many of the fizzy drinks that children enjoy can contain really large amounts of sugar, sometimes more than the recommended daily allowance. So once again, check the labels, and the best good rule of thumb is just to avoid drinks with added sugar altogether. Water and milk are the best options for children. But you can make it fun. You can get children involved in making alternative drinks, fruit water, for example, by including some fruit and some herbs in the water as well. And they're definitely low in sugar. We have been asked to mention organic and ethically produced foods during this session. These are generally better for the environment, but we understand that they can be more expensive, so and also not as available in all areas of Glasgow. Our partnership supports initiatives that help people purchase healthy and more sustainable foods. So what we actually are working on with Glasgow Sustainable Food Directory, or have been working on since 2021, is the Glasgow Sustainable Food Directory, which includes more ethical and sustainable food shops and suppliers. And one of them is Green City Whole Foods. And they have actually agreed to put on an introductory offer for the holiday program grant holders. They're happy to offer 10% of your first order with them. So if you're interested, you can contact them directly, and there should be an email address that is put in the chat. It will also be shared after this event as well. We also thought it was really important to mention allergies. It's very important that any holiday food providers ask about allergies. Some of you, we realize, have been running these clubs for a long time, and you probably have a really good way of doing this already. In this slide, I have included the 14 most common allergens. However, this is not all the allergens. People are allergic to a whole host of things. We can't claim to be experts in dealing with food allergies, but Glasgow City Council catering team has kindly provided us with some useful tools which might help you. These include a dietary requirement form, which you're free to use, and that will be posted on the chat. Also on this call, there's the food safety advisor from the Glasgow City Council school catering team. So if during the Q&A you have some questions relating to allergies, he's very happy to answer them. Also, I have included links here for Anaphylaxis UK and Allergy UK, because they have more information on food allergies as well. We are also working on a holiday program toolkit for all of you. And this includes things on nutrition, food safety, sustainability, including some sustainable suppliers, some recipes from various different sources, and fun activities you might want to include during your session. So this will be sent to you sometime next week. I'm going to stop sharing my screen, and we're now going to play a short video from Nutrition Scotland, which is titled Healthy Eating on a Budget. And it has been especially made for this session by Glasgow-based Nutrition Scotland They are a social enterprise specializing on community nutrition training and development. And these links that you will see here will be shared after the event. We will now hear from Gillian Edgar from the Scottish Grocers Federation Healthy Living Programme, and she will tell you how your local convenience store can help you access healthy food. Over to you, Gillian.
Thanks, Rika. Good afternoon, everybody. As Rika said, my name's Gillian Edgar and I work for the Healthy Living programme. So I'm just going to sort of share some information today with regards to what we've been up to in terms of convenience stores across Scotland and how we can encourage the retailers and consumers to pick up the healthier choice. Okay, so very quickly, just a bit of background as to what the Healthy Living programme actually is and what we are trying to achieve. So it was set up nearly 21 years ago. We're fully funded by Scottish Government, and it's basically to work in tandem with the Scottish Government policies on a healthy weight and diet and type 2 diabetes, and encouraging Scottish convenience stores, independents and those that are part of a wider group to embrace the responsible retailing ethos and to stock good ranges of fresh fruit and vegetables and then other healthy products as well. And trying to really move away from the traditional confectionery soft drinks snacking environment, which is obviously still very much to the fore within that arena, but we're obviously trying to push the healthy agenda as well and to promote the healthier options by targeting the consumers directly in store and trying to change shopping habits where we can. We categorise our retailers into 3 different areas. When you first join the programme, you're classified as an essential retailer, and we look at the merchandising within store. Where are the products placed? Are they first in flow, as they would say, within the store layout? Is there a decent range, and is it affordable? Because convenience stores, by their very nature being convenient, they're not always the most cost-effective option. So we try to encourage our retailers to make the products that they're selling affordable for everybody. Once you've been with the programme for a while and you're moving on to the next level, you're looking at some sort of community engagement. What we've found is that basically the areas that we're targeting tend to be areas of multiple deprivation, and people are very loyal, in fact, to their local convenience store. They shop there day in, day out. They either don't have the ability to go to any of the big supermarket stores or discounters, or don't have the means. And so therefore the store is the heart of their community, and we look to try and cement that relationship within our sort of core range of retailers. So for example, they may set up a loyalty scheme where you buy 4 pieces of fruit and number 5 is free, that sort of thing. Very, very simple concepts, but it's something that's relatively new to the convenience sector. Once you've spent some time within the kind of core area, you then move on to what we would look at as our premium outlets, where they have a very wide range of items. They're perhaps offering a food to go counter where they have breakfast rolls, lunchtime snacks and soups, sometimes even evening meals as well. And our emphasis there is obviously for them to always provide a healthier option for consumers. So maybe not just the traditional breakfast fare of rolls with bacon and sausage, etc., but also perhaps porridge pots ready to go, soups at lunchtime, salad boxes, that kind of thing, and a healthier meal in the evening, not necessarily just your traditional burgers and hot dogs. And again, we step up the level of community involvement with our premium retailers. We try and encourage the healthier options in store through a variety of different point of sale materials. All of this is free. The retailers can have as much or as little of it as they wish. And obviously it's eye-catching. It's to try and drive the consumer to the areas where the healthier products are stocked. As Rika alluded to as well, we concentrate on frozen food, frozen fruits and vegetables as well, because frozen can be just as good as fresh, and oftentimes far more economical as well for the consumer. So the point of sale that's available for the retailers is all free of charge. So really, we like to think that it doesn't give them any excuse not to try and be promoting that healthier choice within store. Now, I alluded a wee bit to about some community involvement. Where we've had some real success over the past sort of, I would say, 5 to 7 years has been our breakfast programmes. So we launch a breakfast club called the Welby Breakfast Club. Welby is our banana figure, which you'll see in all of our breakfast branding. And what we do here is we work with a local retailer who perhaps already has a connection to a local primary school, and if they don't, we'll make the connection on their behalf. And we go in and we host a one-off breakfast event where every child in the school from primary 1 to primary 7 comes down to the dining hall and they sample a healthy breakfast choice. What we give them on the day is a small selection of fruit, which they get in a wee pot, some Weetabix cereal with banana and some toast with banana. All of the choices that we give them have to meet the food standards regulation in terms of nutritional guidelines that we adhere to within the programme, which is why it's a relatively limited range of items that we can offer them, but obviously with the focus on the healthier choices. And the message really is very, very simple. It's A, have a breakfast if you can, and B, try and make it a healthier choice. And all of the choices that we provide are provided by the retailer themselves. So it could be your local Premier store, day-to-day store. You may have seen these fascias round about in your local communities, Scotmid, Spar, all of the big brands and all of the main fascias are involved with the programme. And so all of the foodstuffs are provided by the retailer themselves. So consequently, you can then buy them in the store. So the point being, your child has a sample of some fruits at the Welby breakfast. They can then go home and say to whoever's at home that they tried tangerines today, they tried pineapple today, they tried melon, and they liked it. So if there's a limited amount of money perhaps to be spent in the household, it takes away that element of risk where the adults aren't sure whether they should buy the items for the children because it could potentially be a waste of money because they might not want to eat it. But if we can let them try it, and use the positive force of peer pressure where the children all tend to get stuck in and enjoy it because all their friends are doing it, then they can relay that message back home and hopefully encourage their parents to go in and pick up the healthier choices the next time they're in their local Spar store or Scotmid, whatever it might be. So to date, as I say, over the past sort of 5 to 7 years where this programme's really gained momentum, we've served a breakfast to over it's actually now 45,000 pupils across Scotland. Covering right from the very northern tip right down to Dumfries and Galloway. And we like to think that that has a lasting impact within the school, that children can then, as I say, go home and say to people at home, I've tried Weetabix today, I've tried some toast, and I enjoyed it, I had a slice of banana on it, can we have a go at that at home? And hopefully send that message back home to their family members. And apart from anything else, it's great fun. They enjoy the distraction and the different activity on during the course of the day. With our stores, our retailers, once they achieve the premium level, then they accept the recognition that comes with that, and we basically plaster it all over social media. We shout about what it is that they have achieved, whether they've just fed a school of 600 pupils a healthy breakfast, and we like to talk about it. So we make sure that the retailer gets the recognition that they deserve, that the community acknowledges that, and that they see that they're working in the same side as them and they're all part of the bigger team. So obviously that happens during term time because we're in schools and we're there to provide the breakfast options for the kids over the course of the term. But latterly, and actually off the back of the pandemic, there was an emphasis to be put on cooking at home and to try and encourage family members to basically cook from scratch rather than going for the perhaps easier option of convenience meals or takeaways. Because obviously not only can it be expensive, but they can also be very, very unhealthy with additional salt and sugar added. So what we did with this one is we have highlighted a selection of recipes that we use from the Parent Club website, and hopefully they're all family favourites, as you can see a variety of them here. We've had all of these recipes prepped and filmed. They're all up on YouTube by Scotland's national chef Gary McLean. So there's how-to videos available via our website or, as I say, on YouTube to show consumers how they go about prepping these dishes. And the point of sale is available in a variety of the convenience stores. So if you want to cook up spaghetti bolognese, for example, you should be able to pick up the recipe card from your local participating convenience store and, crucially, the ingredients to prepare that meal, so that it makes it a little bit easier for people to pick up the things that they need to produce a healthy meal for their family in the evening. We've been working as well with Social Security Scotland, and we worked extensively with them over the past 18 months with the relaunch of the Best Starts food card. So when this was relaunched, it was people who are eligible for it now receive it on a prepaid, a preloaded credit card system. And we did an education piece working with Social Security Scotland to let consumers know that this was the system that was changing, how they could use it, what they could use it on. I had hoped today to share some point of sale with you that would have a kind of combined message of, guess what, you can use your Best Start food cards on all our healthy recipe items within the convenience store, so that the message was getting across that you can buy lots of different things with the Best Start food cards, as well as the traditional milk and bread options that have always been used for that in the past. When I do get the final kind of drafts of the point of sale, I'll hopefully be able to share that with you in the future. But it is something that we're continuing to work together with Social Security Scotland to get that message across. Because fundamentally, there's actually a lot of money sitting in cards in people's drawers. Either they've forgotten they have them, they're not sure how to use them, they don't know what they can spend it on. And we want to get the message back out there that it can be spent locally, it can be spent in your local convenience store, and it essentially can be used to buy anything, but we would like obviously the focus to be on the healthier choices that are available in the stores for family mealtime. So to give you an example, primarily over the summer holiday break, obviously this is when it becomes tricky sometimes for families to be providing healthy options for their children and providing good, family meals, because the children are maybe used to having their main meal of the day in school. We are working with Phil's Hill, which is a local wholesaler based in Renfrew, a family business that's been in the go now for over 150 years. Their fascia that you may have seen out and about is Key Store. So in order to work with them and their commitment for responsible retailing and for helping their consumers, they're going to be offering in store these kits. So we basically branded up a very simple tomato pasta recipe card, which consumers can pick up, and they can pick up the free meal kit on the day as well. So that will have the pasta, the chopped tomatoes, everything basically that you need to make this item. There will be some input from the retailers as well, but Phil's Hill very generously are providing the bulk of the goods. And it's really just to kind of spread that message that, these guys, these retailers are on their consumer side. They're trying to do the best they can over the school holidays when perhaps it's a wee bit trickier for families to put a healthy meal on the table. So that's just an example to let you see how we work with the local retailers and wholesalers across Scotland to try and promote the healthier choices. We've done similar initiatives with Spar, and we're hoping to do something very similar come autumn winter time with Scotmid, with a bespoke soup recipe to combine whatever promotional activity they have on their vegetables and soup packs to then make the healthier soup choice, and that then makes it easier for the consumer to pick up those items and hopefully prepare the items at home. And that, I believe, is me. That's me finished for just now. If there's any questions, I'm happy to take them just now or discuss later on.
Thank you very much, Gillian. There's a Q&A session after all the speakers, so we'll just do that all together. Unfortunately, our next speaker, Chris Kane from the Food and Climate Action Project, was had to cancel last minute, but he has sent some slides, so I will do my very best to go through some of his slides. We do work very closely with the Food and Climate Action team, and the project was actually created to deliver some of the community food actions from the Glasgow City Food Plan. So the Food and Climate Action, in case you don't know, is a partnership project between the Glasgow Community Food Network and 5 community food organizations in 5 different localities around Glasgow. They see simple acts like growing and cooking as vital steps towards a more sustainable food system, and they create community spaces allowing people to connect with each other. They focus on cooking through food education, food growing through urban agriculture, and community action through movement builders. movement building. So in regards to food education, their work focuses on sharing knowledge and practical skills, especially on food growing and cooking. But the team also organizes a wide range of events, such as foraging walks, supper clubs, film screenings on concentrating on food and climate. And they also get involved in local campaigns, such as Full of Beans campaign last year, and they offer training around climate change for community workers. Food and Climate Action also leads on the Urban Agriculture Working Group, which is linked to the Glasgow City Food Plan. And by urban agriculture, we mean food growing that increases food growing in the city and allows people to sell on the food that they produce. So this is slightly different to your community food growing, even though, of course, Food and Climate Action is linked to, it's a project for Glasgow Community Food Network, who do those kind of growing activities as well. They also focus on movement building, especially linking grassroots action to decision making at a local policy level. And the work of Food and Climate Action links directly to the Glasgow City Food Plan. Their team shares resources and support to community groups, including annual funding and networking opportunities, and they connect all good work happening at the grassroots level. They collaborate with our partnership and various Glasgow community food projects around Glasgow. And they actually lead two of the Glasgow City Food Plan themes. They lead the theme on community food, where they try to increase people's understanding of the food system and its connections with economic and environmental sustainability. The urban agriculture I have already mentioned before, and they concentrate on increasing land in Glasgow that is designated for the commercial scale food growing. And they're creating markets, routes for markets and for food to be purchased and distributed locally in Scotland. They also promote nature-friendly techniques, including organic food production. You can see here, this is the structure of the Glasgow City Food Plan and its reporting framework. As mentioned, the Food and Climate Action leads on a couple of these working groups. However, their team is also involved in some of the other working groups, such as food poverty, procurement, and food waste reduction as well. The Glasgow Community Food Network looks after updating a map of citywide food-related services that are listed on this slide. And anyone can actually add their services to the map, which is run through an organization called ALICE, which is a program funded by Scottish Government and delivered by Healthcare Alliance Scotland. Finally, there are various ways that you can get involved with the Food and Climate Action's work. They hold quarterly in-person networking meetings through the Glasgow Community Food Network. You can also follow them on social media or email them directly. All the details are found on the slides and they will be shared with you as well. You can also sign up for their newsletter as well. I'm now going to stop sharing, and our next speaker is Charlie Farley, who is the Milton Food Hub Manager for the North Glasgow Community Food Initiative. I saw Charlie coming in earlier, so over to you.
Yeah, my name is Charlie. I work for North Glasgow Community Food Initiative. We've got 3 sites across Glasgow. I work in the Milton site in North Glasgow, which is in the bottom 5% of the multiple deprivation index for quite a few metrics. So it's quite a challenging environment. The facilities we have up there, we've got a community food hub and a community garden. And what we do in the school holidays is we run children's programs for people to come along, enjoy our beautiful community garden, and also get fed through the Glasgow Council holiday food program. So I'm going to talk today just about the sort of stuff that we do and how we sort of implement our approaches, plus the approach of the Holiday Food Programme and how that looks in practice. So our focus, as you can see, healthy eating, growing, harvesting, education about organic farming, things you can do yourself at home. Also, reducing isolation, forming community networks and links and community groups, and bringing all that together in the two spaces that we operate in Milton. Now, we go into the Holiday Food Programme as part of a consortium bid, which is put together under North United Communities. So they're our partners in this programme, and that allows us to have a broad coverage of food provision during the holidays throughout the Canal Ward of Glasgow. Okay. So there's some statistics here of like a number of kids that we generally cover between our consortium. It's over 200 easily. Between the three of us, we combine outdoor play, education, in our case, based around growing and sort of healthy eating and nutrition, and also fun. Okay, so what we do is during the food program is we'll run it 3 days a week, between 1 and 3. And whilst the main aim of the holiday food program from the council's perspective is to allow provision of food to families who would receive school dinners, we surround that with activities that we do that are linked into where food comes from. And you can see there's a wee list here of the sort of stuff that we do. Planting, gardening, growing, exploring through the garden, understanding simple things like differences between what fruits and vegetables are and how herbs flavor food, all that sort of thing. And that's kind of the framework that we have for the sessions. And within that, there will be food provided. And the idea is that we kind of link these two things together as best we can. I could draw particular attention to one of the challenges we had, which gave quite a nice outcome. We ran a barbecue session, I think it was last October, when the weather was decent, and we had over 15 kilos of vegetables, a combination of harvest from the garden itself, which the kids had helped pick, and also food that we get through our Fair Share provider, which is repurposed from what would be food waste for those who aren't aware of what Fair Share does. So we have about 15 kilos of a variety of vegetables, and when presented to young people, staff, parents, and the adults involved were, myself to some extent, quite skeptical that we would be able to get children to eat such a large amount of vegetables just for the sake of trying it. And of course, what we did was we had a barbecue session, which involved gathering together, lighting a fire, and then working with chefs to cook the food on the barbecue and getting the children involved in the process. And then barbecuing it all up because it tastes rather delicious when it's barbecued. And then handing that out to the kids and going one to one around and offering it. And it only takes a couple of young people to say, accept the first offerings, taste it and say, hey, that's not so bad. And before you knew it, queues start to form around the barbecue section. And you look over and what you see is young people are queuing up to eat barbecued broccoli and barbecued lettuce and barbecued peppers and barbecued courgettes. Ingredients which, in some cases, if you try to introduce separately, and parents will report this, myself being a parent will report this, the children would maybe potentially turn their nose up at and be like, not touching that. But by using the barbecue as a vector, making it fun and applying a different cooking technique in a different environment, we're kind of able to unpick the barriers that young people had within themselves for being open to trying healthy, nutritious food. And off the back of that, you can have a discussion about how to do that at home. So it was a good success story. And we try and do that across all of the food that we provide. Another good example of what we did, which I think demonstrates the autonomy that we like to build into the program where possible when it comes to food, is we set up a wrap attack station, as we called it, because marketing is important. And it was nothing more complex than we'd have a stack of wraps that you can see in the picture, and then a selection of foods to put into the wraps. And we allowed the young people entirely to pick what they put in. And then a chef would be on standby and would have a couple of frying pans and would wrap everything up and then cook it, sometimes with the young person if they're a bit older, and then sort of hand it out. So the children were choosing their lunch, in effect, from a limited supply. As you can see from the picture, 4 big buckets of cheese. every single wrap the first time round was a cheese wrap. And of course, the second time people come back up, you start to have conversations about what everything else is. Do you want to try a bit of this? Do you want to try a bit of that? And push them into choosing vegetables to build out their food. I saw on the previous slide or the video from Nutrition Scotland, they had a wee section talking about fakeaways. And fakeaways are really quite a brilliant way to get young people to eat a more diverse diet without running the risk of putting them off entirely. And it will say you might get a wrap from a takeaway and it's got cheese and ham. Great. You put spinach in there and tomatoes. Suddenly you're diversifying their diet, but it still looks and tastes very similar to something they may have experienced before. One of the mantras which we like to sort of operate under is that the bin doesn't require any more food. And if we made food that we assumed was what we think people should be eating, a lot of it will end up in the bin. So we have to transfer the autonomy of decision to the young people with guidance and parameters to try and push them into just going one step outside the comfort boundary of familiar food to them. And as I say, the fakeaways is a really excellent way of doing that because it looks and sounds like something they know, but it is just a little bit better for them, if not much better, especially if it's home cooked. So a third example I've taken here is we have pizza ovens. You can see a wee pizza oven just peeking out the back of that picture. We actually have a full setup to run this as a sort of standalone service if anybody's interested. And we can come along, and as we do in the garden, we will get the children involved with making their own pizzas. And we'll provide the dough, which we make by hand. So it's no flour, water, yeast, nothing more complicated. No additives that you might get with commercial sort of pizzas. And then the children and the young people will go around the garden and will find what produce they might want to put in their pizza. And they will surprise you as always. I mean, people will come back with a handful of kale and be like, will this go in a pizza? And as a former pizza chef, my answer is everything goes in a pizza. And so we'll then get them involved with the rolling, the shaping, the toppings, and have as much discussion as we think we can about the ingredients they're putting on the pizza at the time. And then cook it, everyone walks off, has pizza, and they're very happy about it. And again, it's about shifting that dial ever so slightly from traditional concept pizza, tomato, cheese, adding in extra ingredients, talking about those ingredients, how they're harvested, grown, so how they're planted, grown, and harvested in our garden, and how that reflects to what you might see in the shops or supermarket, and how you can incorporate that in your diet. And the hope is that you're just making very small nudges whilst aligning yourself with our core principles and the principles of the Healthy Food Programme. So this is just an example of what our programme might look like. So 1 till 3, so it's 2 hours, and the activities are drawn from a combination of these things. You can see here we've discussed most of them. And you can see by looking at the various activities, whilst there's food in there, it's all surrounded by garden-based activities based upon planting, growing, harvesting, nurturing, and being in nature. And as much as that is a vector for giving people access to nutritious food, the food is a vector for bringing them into that space and enjoying it for what it is. And the hope is the two complement each other rather well and allows us to get outcomes from that and improvements amongst our community. A couple of figures here in a wee guide on the impact and sustainability that we do. We do tend to use, or always use really now, local Glasgow companies to provide equipment, supplies and ingredients to us. We like to keep it as hyper-local as possible, so keep the money within, say, the Milton area for us if we can, as we feel that's a way of building a more resilient community. There's some figures there on the makeup of young people that come along to our services. And one of the great things that we can do during the holiday food programme is actually we have a day a week where we try and get the parents or carers to come along if they're available. And having had a couple of days where maybe the young people have been just with us, we can then bring in the carers, parents and family members, and there can be some talk about what they've been up to, what they've been doing, and the children give quite good feedback to the parents with a couple of comments like this. So that's me. Thank you for listening. Again, I'll be available for the Q&A at the end to take any questions.
Thanks so much, Charlie. That was a fantastic whiz through the range of fantastic things you're doing up there, Milton. So thank you so much for that. We now have a chance for some Q&A before we get to our breakout rooms. So I'd like to invite all the speakers from this session to unmute and put their cameras on, please. I have a question for Charlie to start off, and I'm just wondering the range of ages of children, Charlie, that you have coming along to the sessions, and whether you need different approaches for different age groups.
Yeah, we are predominantly primary school age in Milton. And that range is what, so 4, 5 up to, I think our oldest is 11 or 12. So there's still quite a lot of variation in sort of behaviours and attitudes within that. The different approaches, it's interesting. The younger the children are, often the more receptive they are to trying new things because they haven't yet haven't yet learned what they don't like so much, perhaps. And the older children, especially those who present with perhaps some ASN, do require perhaps building stronger relationships with. But we, of course, have been doing that over the years that they've been coming to the program. So you won't. I find with my experience of it, you won't get young people to eat something they haven't tried if they don't know who you are, and if they don't trust you. And that only comes through time. It's a very challenging thing to go into a cold room with people and say, "Hey, try this." We're fortunate enough that we have long-standing relationships. Having said that, when I have worked with other organisations where I have been brand new, the novelty can actually work in your favour if you hit it with as much sort of fun as possible and use as many vectors in, and even perhaps make jokes about how much you hate something and try it and make cool faces. It's that kind of like interaction that can make it almost performative. Personally speaking, I've found that if you do it with too much information and factual, this is good for you, you should eat this, this is why, it's not going to wash. It has to be entertaining, I think. Try and break down those barriers.
Yeah, particularly as they're on holiday as well, aren't they? So it doesn't want to be too much like a school-based activity. Yeah.
So I think that's been really, really useful. Certainly, I've certainly picked up a lot of tips as well, and I hope that you all have as well. Does anybody want to share anything that came back from their groups? Will I speak about my group first? Would that be the best way?
Yeah.
Okay. So we had 4 organisations in it that have been providers for quite a long time. And I think what came out of it was that really good tips that came out today. Certainly the one about adding the lentils to the mince. I think, as I said to the group, Glasgow is going to be awash with spaghetti bolognese this summer, all with lentils included as well as mince. So it's been useful for getting tips like that as to how to improve the kind of nutritious value of the food. One of the challenges that's come up is the cost. The cost of food rising and how projects can still deliver with that challenge. To get around that, 2 of the organisations that are close to each other, they've suggested that they're going to get in touch with each other and kind of share details about the supplier, so that they can maybe get joint deliveries or kind of reduce costs that way. So that could be a way forward. Other ideas that came up, I mean, the wrap idea that Charlie had mentioned, that was certainly highlighted as a really good idea, but the challenge for some of the bigger projects was how to manage that when you've got a lot of children. And what some of them suggested was that they stagger it and they maybe do it in sort of 3 different lunch sessions, and that would allow the kind of practical making your own lunch more manageable. But also one of the other organisations is going to include as part of their activity is an air fryer recipe session where the young people, maybe 10 at a time, will have an activity based on what recipes they can use in an air fryer, which they can then take home, because they are reliant on a supplier bringing in their food from a cafe. So that way that allows a kind of healthier approach to be included as an activity. I think that was probably most of the things that came out. And I just wanted to kind of make a point. Oh, sorry, there was another one. There was the little chef, where the children were involved in the menu planning, and they became little chefs, and they took the meals out and prepared them and distributed them to the other children. That seemed to go down well, and it was a kind of peer-led element. And just the last thing I would like to kind of point out, just from a kind of council point of view, is see all these wee things that you do and these wee activities, include them in your monitoring so that we hear about them. And that would be really helpful for us. And that's a kind of quick summary of our breakup room.
Thanks, Christine. I'll go next and just give a quick update from ours, and then I see Charlie's got his hand up. Charlie, did you want to come in now?
Yeah, just briefly, just in case people aren't aware of this, maybe some of the small organisations who are buying food in from third-party services, there are charities who are able to provide food catering services themselves. And going back to the idea of keeping it local and keeping it within the field, I don't know whether people have considered approaching other charities and asking them, can you do our holiday food program, food for us, as a sort of social enterprise? Because there's quite a few organisations now that do that sort of thing. The instinct might be to go to your local cafe or your local private sector, but there is some provision out there.
Thanks for that, Charlie. Yeah, I think that's a really interesting and helpful suggestion. And yeah, there are a wide range of third sector organisations that are providing that service now. So yeah, thanks for that. In terms of our group, interesting, Christine, we didn't get talking about cost, but we were talking about the challenge of encouraging children and young people to eat those healthier foods, and we acknowledged that, to be honest, most children prefer the snacks and the French fries. When some of the projects had tried providing fruit, for example, instead of the usual snacks, it had not gone down well. Let's put it like that. So that there is this challenge of providing more nutritious foods, but also making sure that the children and young people get food to eat, because it's really important that they do get that food when they're there. So what some of the ways that in our group people have overcome that was by continuing to make it fun, as Charlie said, but also giving children a bit of autonomy, allowing them to kind of make choices, choose what they want, but encouraging them and making a wider range of food available. But examples were, fruit skewers, fruit kebabs, chopping up different types of fruit, and allowing the kids to make their own skewers, cutting out shapes from fruit, making pizzas, and just making a wider range of food available for people to try. Also preparing the night before or the day before as to what you're going to be providing, and maybe trying to prepare some sauces, some curries that have got a little bit more veg in them. We also talked about things that perhaps we could do collectively to support this work, and maybe we could think about another kind of networking session to bring people together to share their learning at another time. Also in terms of things that we might be able to help with, we could potentially help with some easy recipe cards for families to take home to try things at home. So a few things for us to think about as well in terms of how we can best support you all in the great work that you're doing over the holidays with the children and young people that you're working with. Okay, I don't know, does anybody else from the other discussion groups want to pop in with some key points?
Yeah, I think from our point of view in our breakout room, it was just an opportunity to kind of share the challenges that everybody faces, and some instances of best practice and how that can be adopted in their own environments. And just, as you said, they're making the connections and seeing what everybody else is doing is really, really beneficial.
One of the highlights from my group, our group is very, very small, but both of the participants said that some children eat food at the holiday club that their parents said they will not go near at home. So it's clearly highlights the fact that the holiday clubs provide an opportunity for children to try new foods, and obviously there's the kind of peer pressure as well that Gillian mentioned during her presentation. That can be a healthy peer pressure instead of the unhealthy one. Also, there's some top foods that were mentioned: sweet corn, cucumber, and peppers were favorites of children of their holiday clubs, and vegetable soups. Soup came up as sort of a winner in getting lots of vegetables in children, because you can actually hide lots of vegetables in soups that children might not try otherwise. So it's definitely a good way to maybe use as a starter, for example. Also pizza wraps seem to be a bit of a winner. What Jill mentioned earlier about the collective networking sessions and recipe cards, we have actually created community recipe books before, which we can actually share as part of our toolkit. But maybe it will be an opportunity in the future to share some of the most popular recipes from the holiday grant holders, and we could turn that into a book as well.
Okay, I would just like to kind of pull everything to a close then. If you've got any other questions for the speakers that you think of later, obviously you can either email myself or any of the speakers directly, and we'll get answers to you. I'd just like to kind of close to say I found it really helpful and informative, and I hope you have too. I'd like to say a huge thank you to all our speakers today. Your presentations were fantastic, and also to everybody who attended the webinar and took a couple hours out your day to come along today. So just to say thanks very much for coming. We'll circulate the presentations and the evaluation form. We'll send that out to you in a few days. And hopefully you've got a wee bit of time back. So enjoy the rest of your day. Thank you very much for attending.